Very much, Angela, for your very warm welcome, and good afternoon, everyone. Thank you for asking me to join you. RNAO Day at Queen's Park is always a very special day for us, and you saw us behaving probably at our worst in question period today, but that's what it's like around here. But it's always great to be with RNAO and members, and I want to thank you, first of all, for the wonderful work that you do in our communities each and every day. You've heard it before, but it's absolutely true that you really are the backbone of our healthcare system. Patients and families in Ontario know that they can receive compassionate and expert care for you at times of acute distress. So when and where they need it, you are always there. I'd also like to express my gratitude to your CEO, Dr. Doris Grinspan, who I've had the great pleasure of knowing and working with for a number of years. I can say without hesitation that Doris is a true advocate for your profession and for the work that nurse practitioners and nurses do in Ontario and for nursing students. She is a true visionary and works tirelessly to advance the field of nursing and health policy. So I'm grateful to her both for her counsel and her friendship, and I look forward to working with you at RNAO in the years to come, as well as with your president, Angela. I know from my previous life as the MPP for Louis Oshawa. Wonderful to be here. So for over 90 years, the Registered Nurses Association of Ontario has been working hard to transform both the nursing profession and patient care here in Ontario. It's your hard work that has helped expand the scope of practice for nurses and nurse practitioners. And now registered nurses in Ontario can prescribe certain medications and communicate diagnoses. And nurse practitioners can now diagnose and treat illnesses, set and cast bone fractures, admit and discharge hospital patients, and prescribe against certain medications. Advocating for harm reduction tools, access to more affordable housing, and your work with Indigenous communities, including your work on the pre- and postnatal work with Indigenous women, best practice guidelines. Congratulations to you on that. I know it's just still working on that, but it's wonderful work and something that's really important to us and is certainly a priority for me in my role as Minister of Health and Long-Term Care. You did hear a question in the legislature today by Mr. Mamekwa regarding some conditions respecting Indigenous health care in the North. It is something that I do take seriously, and while the Minister of Indigenous Affairs is much of that concern right now, it certainly also does fall to health role and health ministry to take a role in that. So I look forward to working with you on making sure that we're able to improve health conditions for all of our Indigenous people. So we understand how important your work is and what a challenge it represents sometimes. We also recognize the challenges facing our healthcare system. The sad reality is that Ontario's healthcare system is on life support right now. Patients are languishing on wait lists, and right now, every day, there are more than 1,200 patients receiving healthcare in hospitals, in hallways, and in storage rooms and other, I would say, inappropriate places for care. And I'm sure you can agree with me that it is inappropriate. It's no way, first of all, to treat our loved ones, and it's also no way for you to be able to practice the kind of nursing care that you were trained to practice and that you want to practice. I know that this is putting a tremendous strain on many of you because you want your patients to be well, and you know that these conditions don't create those conditions. We want to fix that and allow you to be able to work in a safe, comfortable environment where you have the resources that you need and you can care for your patients in the way that you were trained to and the way that you want to. We were elected on a promise as well to create an integrated healthcare system that finally works for the people of Ontario. That's why we will continue to focus on making changes that will ensure people have access to the services they need when they need them. And so they will no longer be receiving care in storage rooms. so that people won't be waiting years for mental health and addictions treatments. These are my priorities, and this is why our government is committed to building a sustainable public healthcare system that is centered around the patient. I can tell you that almost daily since being elected last June, I have been meeting Ontarians to hear their advice on how to tackle the enormous and significant public health care challenge we face. I've toured hospitals, long-term care homes, hospices, and harm reduction sites. I've met with nurses, doctors, healthcare associations, frontline providers and patients, and healthcare associations. In addition to formal consultations on mental health and addictions, as well as on opioids and addictions, which we all know form a significant public health challenge right now. I've also been working closely with Dr. Ruben Devlin and the Premier's Council on Improving Healthcare and Ending Hallway Medicine, comprised of a number of the province's foremost administrative and frontline care experts, as they have also been conducting consultations with sector partners, healthcare leaders, and patients. And I have a fair amount of experience for more than a decade as an opposition politician, listening to people as well as being the patient ombudsman for several years. And I want to assure you that I'm going to continue to consult with patients and with you, with the RNAO, with nurse practitioners and registered nurses, because you are the people who plan and work on the front lines of healthcare in Ontario. And we want to listen to you, we want to hear your ideas, and we want you to be our partner. That's why we invested and are making some changes, but there are many more to come. We invested $90 million to support more than 1,100 beds and spaces in hospitals and community settings across the province to help ease hospital gridlock during the flu season. These beds and spaces will help take the pressure off hospitals, allowing nurses and doctors to work more efficiently and provide better, faster health care for Ontario's patients and families. But we didn't stop there. Looking beyond our hospitals, our government has also made a commitment to create 15,000 new long-term care spaces within the next 5 years. We also made a commitment to make mental health and addictions a priority. That's why we have committed $3.8 billion over the next 10 years to develop and implement a comprehensive and connected mental health and addiction system. This has included so far the addition of more than 50 mental health beds in hospitals across Ontario. But we do know that there's much more that needs to be done in the community, and so we are continuing with those consultations. We want to build more capacity in our hospitals as well, lower wait times for those in need of inpatient mental health and addictions treatment so that people don't end up in crisis and attend at the only place they really know by default, which is the emergency department of the hospital. We know that while our hospitals are doing the best that they can, often people don't receive the actual care that they need. So we want to work and listen to you, the RNAO, because these are vital connections for our government to help inform how we implement these very much needed changes. And it's how expertise is shared. For example, the great work that you did on the recommendations for the ECHO model, on the Indigenous best practices model that you're already working on. Because ideas like these do inform decision making as we move forward towards transforming our public healthcare system in Ontario. I can tell you that we are committed to building a healthcare system centered around the patient and redirecting money to frontline services where it belongs so that it will improve both the patient experience, to provide better and connected care, and allow you to do your work in situations that are comfortable and with the safe, of course, and with the resources that you need. So we also know that there are many determinants for good health, be it physical, mental, or social. And we also know that RNAO continues to push for these positive changes. With your efforts, you demonstrate the kind of commitment we are going to need to improve healthcare for patients and families across Ontario. Together, we will create a public healthcare system that works for all of the people of Ontario. So thank you once again for inviting me to join you. It's been a great